Today we are doing a focused cardiac and respiratory assessment on Joanna Wayne. As always, knocking on the door, perform hand hygiene, introduce yourself, and use 2 patient identifiers. This patient's past medical history includes hypertension, type 2 diabetes, hyperlipidemia, has past surgical history of a hysterectomy. Family history shows coronary artery disease, hypertension, and diabetes. She has no known allergies to medications and is currently using metformin, Victoza, metoprolol, Crestor, and a daily multivitamin at home. Her social history does not report any drinking. Shows that she was a smoker, half PPD for 15 years and quit 10 years ago. Denies any street drug use. Is married, has 4 children and 2 grandchildren. Works full-time as FBI analyst at New York office. And it is unknown her highest level of education, nutrition, and exercise. Diagnostic history shows an EKG, ST segment elevation in leads V1 to V6, X-ray within normal limits, ABGs within normal limits, with a cardiac catheterization and SPCABG results showing coronary artery bypass grafting ×2 and a 2-vessel coronary artery disease with a complex left anterior. Subjective data shows no report of fatigue, no skin color or temperature changes on the arms or legs, does not report shortness of breath with or without exertion, does not report number of pillows used, patient does not report chest pain, no cough present, no swelling in the legs or feet present, and does not report number of times awakened at night with an urgent need to urinate. Chest wall is symmetrical and flat, heart rate regular with no murmur, gallop, heaves, or thrills noted, lung sounds clear, equally bilaterally, proper placement of endotracheal tube, a central venous catheter, and chest tube in place, pulse 86 at carotid and fifth intercostal space, no masses or crepitus present on pericardium upon palpation, aortic, pulmonic, tricuspid, and mitral area are all within regular rhythm, and apical pulse is at 86 beats per minute on ventilator. No cough is present with or without position changes, no phlegm or blood in sputum, no shortness of breath or wheezing, no fatigue, no chest pain while breathing. The environmental exposures that may affect the breathing is New York City, the pollutants in the air. The last known TB and pneumonia vaccination is not reported, and now we must observe the general appearance and posture and breathing effort. Chest wall is symmetrical and flat, anterior, posterior, and laterally. The client's nail, skin, and lip color are within normal limits. There is no chest tenderness, crepitus, or masses present upon palpation. The heart rate is regular at 86 beats per minute upon the apical pulse as well as the carotid. There is no murmur, gallop, heaves, or thrills noted, and the aortic, pulmonic, tricuspid, and mitral area all show a regular rhythm. And as already stated, no murmur, gallop, heaves, or thrills were noted. So for the carotid, we are receiving a pulse of 86. No jugular vein distension is present. Now, palpating the pericardium to locate the 5th intercostal space. Finding that and adding it up with the midclavicular line to find the apex. Now auscultating the aortic, pulmonic, Erb's point, tricuspid and mitral area.